Good. Welcome, everyone. I'm just waiting for those who are coming in to come in, and then we start in a few seconds. Great. I think we have some people in with us now, so we can start. Again, hello, good afternoon, good morning, depending on where you are. And we are very pleased that you are joining us today to this session on the Safeguarding Evidence to Action event. Thank you for joining us. Today, we will be exploring the latest finding on the SCH, sexual exploitation, abuse, and harassment in our sector in aid. My name is Bonaventure Sokpo. I'm Policy and Outreach Senior Advisor at CHS Alliance. I'm very pleased to be moderating this session today. The purpose of coming together today is to explore how data from the harmonized reporting scheme, we will be using the acronym HRS, and misconduct disclosure scheme, the acronym we will be using MDS, how they can strengthen safeguarding, improve response mechanism, and close accountability gap in our sector. And we are privileged to have the opportunity to hear a general perspective on how these tools help share broader accountability system in the humanitarian space. I would like to ask you, participant, to introduce yourself in the chat box so that we know who is attending. Please, your name, your organization, where you are connected from is welcome. I want also to let you know that this session is being recorded. If someone has an issue with the recording, don't hesitate to contact us so that we discuss and solve that problem. We plan to share an edited version of today's meeting on the CHS website so that those who could not attend live can still have access to the key highlights. If this has a problem, as I said before, please let us know. I'll have the pleasure now to introduce our speakers and also explain how this session will be run. So first, before I do that, I would like to tell you a little bit about the CHS Alliance for those who don't know CHS Alliance yet. The CHS Alliance is comprised of nearly 250. Maybe we'll get to 2,000 very soon. From small grassroots organization to large international federation, our members protect and assist people affected by crisis and the communities in over 190 countries, and collectively they represent a substantial proportion of total aid delivery. What unites CHS Alliance members is a shared purpose to ensure that aid is safe, effective, and accountable. Our members commit to upholding the core humanitarian standard. Today, we will hear about different aspects of this work. Firstly, I'm pleased to introduce John Below, Deputy Executive Director of CHS Alliance, who will help to set the scene. After that, we will have the privilege to hear from Mathilde Bailey, who leads the HRS, will present the latest data on SCH from 2024. Then, we also will have this opportunity, the privilege to hear from Elena Bezzolato, who is the MDS coordinator, who will present data from the MDS and its links with the HRS fundings. Finally, we are very privileged to have Dominique Albert. Dominique is head of the programming, control and reporting unit at DDECO. She has joined us. I think you hear us now, Dominique, great. And Dominique and her team manage the outside and accountability processes, including risk management, internal control, anti-fraud, PSEH, and external audit. She will share reflections on how these initiatives contribute to better transparency and protection. We will ensure there is the time for Q&A. We like interactive sessions. So when you are listening to our speakers, we invite you to put your questions in the Q&A box throughout the session so we can monitor that, and then we really have the opportunity to answer some of the questions. With that, I'm so happy to hand over to John, our Deputy Executive Director. Thank you very much.
Thanks, Bonner. A real pleasure to be with you all today. It's great to see so many familiar names in the chat, and also just the interest in this. It's really encouraging. Working as a humanitarian or development practitioner, you see the very best, but also the very worst humanity has to offer. From the inspiring actions of people affected by crisis to the compassionate dedication of those serving them, but you also witness the horrors of war and are aware of the hidden challenges, the abuse and exploitation of vulnerable individuals by those who are meant to be protecting them. Working in such an environment, it's very easy to become numb to or perhaps turn away from injustice and the suffering and abuse. The fact that you've joined this meeting today means that you haven't turned away, but you've lent in. Thank you for that. Today, you'll hear statistics and trends about one of the greatest accountability failings: sexual exploitation, abuse, and harassment. And my request to you all today is that you allow yourself to be outraged by these statistics and trends. They are truly shocking. But then you also consider, what can my organisation do about this? As I'm sure you all know, this is not a small scale or peripheral issue. It's regretfully systematic, and it's of central importance, and as such demands our attention. The CHS Alliance is responding to sexual exploitation, abuse and harassment by offering its members support with training and through a range of practical accountability mechanisms, from the CHS itself to the linked PSEH index, the misconduct disclosure scheme and the harmonised reporting scheme, which you'll hear more from later today, but also the investigator qualification training scheme, and by working with communities on survivor-centred complaint and response mechanisms. These resources allow organisations to spot where incidents are happening, to understand who's most at risk, to identify gaps in accountability mechanisms. They help to prevent repeat perpetrators from being rehired, and they ensure that investigations are carried out by trained investigators who understand survivor care and due process. Most importantly, they support systems that centre on the rights and the wishes of survivors. Taken together, we hope that they help organisations with the safeguarding elements of the core humanitarian standards and putting them into practice. This is what it's about, not just evidence, but moving to action. And they do this by giving organisations the information, the tools and trained people they need to be able to respond with care and accountability. I hope that today's meeting provokes some really good discussion, that you continue these discussions within your organisations. And if after today's meeting you're interested in learning more about CHS Alliance, becoming a member, or about our various safeguarding schemes, then please email CHS at the link that you can see in the chat there, info@CHS Alliance. Without further ado, I'm going to hand over to Mathilde. Over to you.
Thank you, John. Hi, everyone. And Bon, if you can start screen sharing, please. I will start with a quick explanation for anyone unfamiliar with the Harmonized Reporting Scheme, or the HRS. It's a simple, free, and confidential platform that allows organizations to report incidents of SCH in a safe, fully anonymized, and standardized way. It also allows organizations to have access to data visuals to see trends for their organization specifically, as well as aggregated trends for the sector or for a country more widely, but without any risk of identification. So the aim here is really to understand what's happening, where, and how we can do better together, rather than looking at our cases individually. Since the HRS was scaled up in early 2023, after several years of consultations and piloting, you can see some numbers on the screen here with more than 680 incidents that have been reported. They came from 92 different organizations, including international and national NGOs, private sector actors, and the Red Cross Red Crescent movement. And they covered over 85 countries, showing just how widespread the reach and engagement has become. In 2024 alone, 376 SEH incidents were reported into the HRS, 65% against aid recipients and their community, and 35% were incidents that happened on the workplace against staff. The data is fully anonymized, no names of organizations, victim survivors, or alleged perpetrators, no identifying details, but the patterns it reveals are really powerful. It really allows us to understand where risks are concentrated, who's most affected, where systems are working, and where they aren't. So the more organizations join, the clearer the picture becomes, and the better we can act collectively to protect the people from this harm. Next slide, please. So most incidents reported in 2024 came from Eastern and Central Africa. Western Africa, Southern Asia, and the Middle East also feature prominently, and you have the percentages on the slide. And at the country level, the Democratic Republic of the Congo, Bangladesh, Syria, Ethiopia, and Kenya have the highest reported numbers the highest number of reported incidents, sorry. Yes, these are high-risk contexts, but high numbers of reports don't always mean high prevalence. They often also reflect functional reporting systems on one hand, and that survivors, staff, and communities are speaking up to some extent. But they're also linked to high numbers of organizations reporting into the HRS in those countries. So the real concern lies at the other end of the spectrum. The real red flags are countries with high presence of organizations reporting into the HRS and very low or no reporting. So take Mali as an example. Not a single case was reported in 2024, despite many HRS organizations working in country. Somalia, Niger, South Sudan, Ukraine, Myanmar, Colombia, Haiti, Burkina Faso also reported fewer than 5 cases each, despite 15 to 20% of HRS organizations working in those countries. This obviously does not mean that SEH isn't happening. It means it's not surfacing. And when incidents don't surface, they can't be addressed. It means no accountability, no support for survivors. And that's really where the problem lies. Now, how are people reporting? How are these cases coming out? Almost half of the cases were reported face-to-face to someone from the organization or somebody from another organization. Only 1 in 5 cases were reported through mechanisms like hotlines, apps, complaint boxes, 10% through internal whistleblowing channels, 9% through community leaders or PSEH focal points, and the rest were either unknown or undisclosed. These findings are consistent with what we've seen in previous reports, and they tell us a nuanced story. Yes, formal systems matter, hotlines, complaint boxes, etc., but we can't over-rely on them. Reporting does have a deeply human side to it. Many disclosures happen in person to someone trusted, and that's why it's critical to offer multiple reporting options, including face-to-face ones, because no one channel will ever work for everybody. We've seen the same in the CHS Alliance's participatory research on victor survivor-centered approaches. Survivors are most likely to report to somebody that they already trust, often a female community leader, a female staff member in a clinic, another local figure. So these trusted intermediaries play a crucial role to combat underreporting. And most importantly, what can we take on this? We need to train those on the receiving end. We need to explain to them how to receive disclosures, refer survivors, and respond with care. They don't need to be experts. We're not all going to be SEH experts from one day to another. But we all need to, if we're going to be in contacts with communities, we all need to know the steps that we need to take so that the survivors can reach the actual expert in a safe and dignified manner. This is critical because one poorly handled disclosure, just one, can really break trust in the entire system. Next slide, please. Now let's turn to the victim survivors at the center of these incidents. The data confirms what we've seen in every report so far. 95% of victim survivors are women. That's not surprising. SEH is rooted in unequal power dynamics, gender inequality, but it's just a reminder of what's driving the harm and who continues to bear the brunt of it. And then there's a really alarming trend. 35% of all victim survivors are under 18 in incidents against community members. That means that more than 1 in 3 victims are children, and more specifically, they're girls. This is not an outlier. We've seen the exact same pattern in all 4 reporting periods. UN data, incident data shows exactly the same. So this really is a systemic issue that demands urgent prioritization. Now, are survivors receiving support? Some do, but too often the answer still is no. Across all cases, we saw that 37% receive psychosocial support, which is the type of assistance most accessed. Only 11% receive medical care, 8% access legal assistance, and just 2% economic support. That leaves us with around 40% of victim survivors who receive no assistance at all. That could mean it wasn't offered, it wasn't available, it was declined. Whatever the reason, the result was the same, no support. And this is a massive accountability gap because reporting is only the first steps. If survivors don't receive care, the system has failed them. And we know that they will probably never report again. So what can we do? First of all, absolutely prioritize child safeguarding across all sectors. The figure on child survivors is enormous. So that means not just education, not just child protection. Any community-facing activity should assume that children may be present. And we need to ask ourselves and ask communities, how can we ensure this activity is safe for children? Could it create risks? And then really build these risk mitigation measures, these safeguards into the design and the implementation, not wait for incidents to happen, but make sure that children are protected throughout. We need to make sure that survivor assistance is a core part of our SEH response, not that we have just our internal procedures, but that these procedures include that survivor assistance, that it's not an optional add-on. It doesn't mean that we all need to become GBV service providers from one day to the other if we don't have that expertise, but we do need to know who has the expertise, how to safely refer survivors to them, and have a contingency plan when that expertise is not available close to us. So for instance, that can mean covering transport costs for a survivor to access medical care in a clinic that's further away. So yes, this includes budgeting for survivor-centered support, but referrals to these services need to be resourced when they are not freely available. And then again, as I said before, really need to make sure that the people who are in regular contact with communities know who to call and what to do when a disclosure happens, because it is the people who are closest to the community that will get these reports. Next slide, please. So turning to the profile of alleged perpetrators, several groups consistently stand out across all of our reports, and 2024 is not an exception. We're seeing that, unsurprisingly, frontline staff are alleged perpetrators in 1 in 3 reported incidents. But we're also seeing that people who are contracted or appointed to do activities or provide services on behalf of organizations, so these affiliated personnel, so that's volunteers, contractors, vendors, partner staff, incentive workers, they make up the largest share of alleged perpetrators at 38%. Managers account for 13%, and in 15% of cases, no individual was identified. But the picture changes depending on who the victim survivor is. When the incident is committed against a staff member, the proportion of managers and alleged perpetrators skyrockets. 43% of alleged perpetrators in incidents against staff are in management roles. 33% are middle managers and 10% are senior managers. So that's incredibly high and deeply concerning. It tells us a lot about organizational cultures. These are people in positions of power responsible for team oversights. So if they are the ones that are causing the harm, the stakes and obviously the barriers to reporting are even higher, and the harm goes way beyond the organization. If we can't protect our own staff or hold our managers accountable, how can we expect people in our teams to protect the communities that we're meant to serve? Meanwhile, as I said, when incidents involve community members, the group that really emerges are people contracted or appointed to work on behalf of organizations. These are often short-term assignments, as I said, volunteers, contractors, vendors, local partners, incentive workers, etc. They don't have a staff contract, their engagement is limited in time, and therefore what we're seeing is that they often fall outside organizational processes for PSEH. And yet we know that they are often the face of our organization in the community. So this dual position of powers makes the risk level incredibly high. They carry a real power by working on behalf of an aid organization, while they're also often very much embedded in the communities where the survivors are from, making them probably fear retaliation and exclusion. So the silence will begin even before there's a possibility for disclosure. So the response really cannot be, they're not our staff, so there's not much we can do, or, we're limited in the measures that we can take. If they represent our organization, they have to be part of our safeguarding system. So what can we do? At a very minimum, systematically brief them on PSEH and expected conduct. Surely, we take the time to explain to them the work that they need to do, right? We get them to sign or put a fingerprint to make sure that when the work the work is being done. So surely we can take an extra 50 more minutes to brief them on expected conduct and consequences for breaches. Secondly, let's supervise and monitor what's going on. It's not enough to just work through these people and then hope for the best. We need to have a focal point on site who can oversee the activity and act as a reporting channel in case of issue. If we can't safely oversee an activity or a service, we should really reconsider the modality. So we can't keep turning a blind eye on the harm caused by people that are working on behalf of our organization. For the community, the type of contract does not matter. To them, they are our organization. So we really need to rethink our internal processes to prevent incidents before they happen, which is much more cost efficient than having to respond to the actual incident. Now, what is the status of all of these reports? Out of all incidents reported into the HRS in 2024, 46% were substantiated, 19% unsubstantiated, 11% inconclusive, 9% not investigated, and 13% still open. Overall, only 1 in 5 cases gets reported to the authorities. While it's positive to note that almost half of the cases get substantiated, which is slightly higher than what we've seen in previous reports, we also know that false reports are rare, so this number should be much higher. And when we look at the responsive actions that are taken, when we isolate the substantiated cases, so for substantiated cases only, we see that there's only 46% that have led to dismissal, 18% of alleged perpetrator receives a warning or a sanction, and then 6% had their contract that was not renewed, or 4% resigned. And the last two might seem like a response, but they just mean that the person leaves the organization with a clean record. So even in those cases where we did confirm SEH, our actions are not always decisive. And when we dig into the actions taken by the profile of the alleged perpetrator, we continue seeing inconsistencies. And you'll find much more details in our reports that are on our website. But we're really seeing that with senior managers, they face less decisive actions than frontline staff. And we see no action being taken much more frequently with short-term contracts or engagements like volunteers, contractors, vendors, and incentive workers. And then interestingly, when we look at the outcome of unsubstantiated, inconclusive, or not investigated at all cases, we still see that many incidents lead to action, including some dismissals and even more non-renewals, warnings, or resignations. So this is important because it showed that these cases were not false allegations. Something serious enough happened to trigger action. So 46% of substantiated cases does not mean that only 46% of reported cases were SEH. It means that we are still struggling to substantiate claims. And this is really a stark reminder that we need to strengthen this investigation process so that when SEH happens, we have the tools, the skills, and the systems to substantiate it and hold perpetrators accountable rather than putting all of the burden of proof on survivors. So John mentioned this. We have the investigation qualification training scheme, which we're really happy to announce has been just relaunched. It provides robust trainings for victim survivor-centered SEH investigation. We really need to make this kind of training accessible, either at the organizational level, including for small organizations, or through other mechanisms like country-level pools of trained investigators that organizations can call on. And just like survivor support, investigations need to be resourced. SEH happens in all organizations, so it's really part of the cost of doing business, and we should all have resources to be able to do these investigations. And then, of course, Elena will speak in just a moment about the misconduct disclosure scheme, which tackles the other part of the problems of perpetrators moving around. But before, I wanted to quickly kind of bring us back to the bigger picture. Right now, the data from the harmonized reporting scheme reflects only a portion of known incidents because not all organizations in the aid sectors are participating. And even if they did, we know that this is what is being reported is just the tip of the iceberg, and many incidents still go unreported. But if we want to move from a fragmented insights to real accountability, we all need to play our part to contribute to these public good initiatives on SEH. So only with that collective picture, we can truly understand where the risks are, what's working, what's being missed, why survivors are speaking out or why they aren't, and how we can fix it together. So let's continue to try and uncover the full picture. Let's continue building on this data that we have so that we can together work collectively to act on it. Elena, over to you to tell us more about the MDS data.
Thanks, Mathilde, and hello again, everyone. Thank you for joining us today. So I will take the next 10 minutes to take you through the misconduct disclosure scheme. Obviously, very quickly overview for those that are not that familiar, but how particularly we'll look at the 2024 data for the implementation of organizations that are using the scheme, but all more in detail focus on some of the trends that Mathilde just highlighted, and how they sort of share a specific light on what we're doing with the MDS. So really kind of try and connect some of these areas. So to start very quickly on sort of what the MDS does and how it comes together with the HRS. Obviously, they're both kind of CHSA hosted initiatives, solution-oriented, very much kind of looking, they both sort of have been created to cover a gap that has been identified. On the MDS, we also have the co-facilitation of the Steering Committee for Humanitarian Response, and they are both schemas supported by the UK FCDO. They set a common framework for action. So the idea is really to generate actions through a framework that organization can pick up, and they are very much for all type of organizations in the aid sector, but beyond that as well. The idea and the aim for both is really to improve collective action on SEH, but they both have a very specific focus and a unique entry point, so that we tackle the issue from a different perspectives. On the MDS in particular, the focus is very much on safe recruitment. It kind of entails peer-to-peer checks, facilitates bilateral sharing of existing misconduct data between employers, and as Mathilde mentioned, address the specific problem of known abusers moving between organizations undetected. So really been identifying as one of the main gaps to sort of being tackled in the area of safe recruitment, and making sure that known and substantiated misconduct is flagged at the stage of recruitment. It's slightly older than HRS. We've had a few more years under our belt. We're now in the 7th year of implementation, which means we've been able to kind of run a bit more and understand what works and what doesn't, and how to help. And one, I think, important point on data is that we collect implementation data, so very much connected to what we're doing as a result of the implementation year. In particular, it's an annual reporting, and this helps to support the practice, the promotion, and the advocacy, but obviously is not the main scope of the scheme. So what we do is really look through the data to see how we're doing, how organizations participating are doing, and also really happy to start kind of looking through and compare with wider trends on PSEH. So this is a very much beginning of the journey. So we're happy to continue doing this and receive feedback and comment on maybe areas that we are missing out on. Next slide, please. In 2024, this is how the scheme has performed. The MDS has performed. So we covered around 46,000 recruitment with over 56,000 MDS requests. A huge number of them received responses, and 195 applications have been rejected based on these checks. What does that mean? So we have a 94% response rate, which tells us that committed organization, it works both ways. Organizations want to check their recruitment, but they're also happy to provide this information, which is really a big kind of achievement in their sense. We have around 1.2 checks per each hire, which means that every hire is checked at least once. We would like this to be more. We would like this to be around 2 to kind of sort of show consistency and making sure that we have multiple feedback. But we get there, and we am really happy that to see this sort of growing in the year. Around 4.2 every 1,000 applications have been rejected in 2024. It's relatively small number, but it shows that people are scanned through, and sort of a minimum net and a minimum bar is in place and works. To give you an overall sense, we have 323 organizations signed up at the end of 2024. We're now probably more closer to 350. And 580 applications have been rejected in total since 2019 based on negative or missing feedback. So just to give a sense, there is an impact, and even if the bar is very low for the MDS, it works, and it's worth continuing looking at this very, very closely. Next, please. So I'll focus on a couple of the points that Mathilde raised on the HRS 2024 data, just to kind of spot some light, as I said before, on areas that are worth looking a bit more into, particularly from the MDS perspective, and so from the implementation side. We've seen that with a low case of cases reported to national authorities and low cases going through other specific criminal kind of process, the MDS might be the only flag available, so that people know that misconduct has happened, and this person might have a history of misconduct. So it's really important that we keep it. It's really relevant. It's one of the elements, obviously, to use in vetting and in background checks, but it shows that it's really relevant to keep this separate and keep this sort of level of check on the administrative side. And then the number of substantiated cases really gave us a sense that there is a limited number of cases, of reported cases that meet the threshold, because on the MDS, obviously, only substantiated cases are reported, and there is a way of flagging ongoing investigations, but that would request a follow-up. So really, it's essential that what we do what we do well, and that the checks are consistent, because it can only cover a small part of reported cases. It also shows a big gap that we still have in this area, and how, and Mathilde was mentioning, what is the follow-up with all the cases that either remain unsubstantiated, or that are still pending, or that are inconclusive. So this is a big gap that I think as a sector we need to look into a bit more. Next slide. The other element is on the type of staff. Obviously, looking at recruitment and safe recruitment, this is an element that we need to look into very closely. We really need to extend as much as possible the checks to all type of contracting and partners. Obviously, the MDS is designed primarily for sort of usual employer kind of type of contracts, because it sort of relied on that system being in place. But volunteers, consultants, all different type of contracts can be checked through the MDS. It's just a matter of adjusting who we're asking the questions to, and how we look through person profile. But also, what do we do with the whole third party, contractors, etc. element that might escape the usual procurement process? And I think that's a big question that we need to kind of answer more in detail, because as we've seen, this is a huge part of the cases that are out there. And then we obviously have a strong necessary focus on field and national staff contracts, and making sure that we first expand our outreach to national and local organizations more and more. This has been happening a lot in the last couple of years, but we still need to do that very intentionally, and that the participating organization for international particularly, that we start really looking at implementing at country level and all national offices covered, etc., particularly for high risk. Next, please. Thank you. Very timing. Other very quickly area for focus that the HRS data sort of bring up the whole piece around sexual harassment and need for adopting comprehensive definitions and approach, how we treat sexual harassment. Is it the stuff? Is it comprehends obviously community cases, and how we take it more or less seriously. So what's the status of sexual harassment, how we deal with it. A lot of MDS implementing organizations includes it. I think we need to take a uniform approach. The geographical focus and coverage, I think that, as I said before, there's a need for focus specifically on higher risk countries and other and kind of more focused areas, but how we take this forward also as a piece, as organizations. And then obviously connect these initiatives with communities, with frontline. We need to show that organizations are doing, taking effort, but that we don't sit there looking at these elements, and that can help enhance the reporting and the requests for accountability, because people reporting know that there's an outcome of that, and there's an impact and a consequence on these behaviors. Bona, I'll pass back to you. Thank you very much.
Thank you very much. Thank you for all our speakers. I want to say thank you for this. You can see in the chat and the applause and the like and everything that is coming up. I think people, they love this data that we are sharing, analysis behind it. Just wanted to remind that we will take some time to answer questions. There are a lot of interesting questions that are coming in the chat box. Thank you very much. But now let's move to Dominic. Dominic, I'm pleased to give you the floor to guide us a little bit through how you have oversight this. Thank you.
Thank you. And first, thank you very much for the two excellent presentations. I think I would join all the participants in clapping because indeed, I think that's quite informative, and it allows demonstrating the usefulness of those two tools. And thanks for giving me the opportunity to share some reflection and maybe to bring the donor perspective into the topic. So let me maybe first refer to the current context in which we are all working. I'm here referring to the funding cuts, the US cuts, but not only a few other donors. Why am I referring to that? Because I believe that it is even more reason for us to be quite serious when it comes to reinforcing accountability. I think that's quite crucial if we want to ensure trust in the humanitarian system. And I'm not the one to tell you that incidents of sexual exploitation, abuse, and harassment not only have devastating effect on victims and survivors, but also undermine the overall credibility of the humanitarian system. So we need to work on prevention. We need to work on reporting because, as you well demonstrated, this is the way to improve the quality of what we are doing. So prevention and reporting of SEH are very high in DG ECHO policy agenda. You might be aware that we adopted recently a policy package on the topic. And we really want to make sure that reinforcing accountability will support us in ensuring our legitimacy and credibility. Referring again to the context, I would refer to the humanitarian reset and the overall reform that the system is, in a way or another, doing. There are two elements that for me are important in relation to the two initiatives that you presented: simplification and efficiency. Of course, by having a common system of reporting, that's a simplification of reporting for all of us. for partners when they report the incident, but also for donors if we want to have an overview of what's going on. It's also crucial for efficiency because by definition, it's saving a lot of resources on both sides. So I think that's pretty crucial in this particular context. I will not restate all the usefulness of the two initiatives because I think the two presentations were very well done in that respect. As a donor, that's quite crucial to have access to reliable data when it comes to SCH, and I think the harmonized reporting scheme is a pretty useful tool in that respect. For us as a donor, having a clear view of what's going on is, of course, useful to engage with our different partners on issues linked to SCH. It gives us entry point to discuss. So I think you mentioned that we can see different patterns in terms of reporting, mentioning Mali, Somalia as countries where it happens that not much cases are being reported. That's also something that we saw as a donor, and I think that means that there is something to discuss in the way the humanitarian system is organized in those countries, for example. About the misconduct disclosure scheme, I think the numbers that you presented are striking. And ensuring that perpetrators aren't rehired by other organizations is crucial when it comes to preventing that things happen again. So it's even more necessary if we take into consideration that only a small percentage of confirmed cases are reported to authorities, and therefore the checks of criminal records can only provide limited information. So for us, there are two excellent initiatives that go in the right direction. And as DG ECHO, we fully support those two initiatives, and we would like to discuss with other donors to try to align as much as possible. So as EU, of course, we are well placed to coordinate with the EU member states, which are important donors for the humanitarian system. So we will, and we are discussing those initiatives with them. So I think that's something that we would do. What we are also committed to do is to align our reporting system as much as possible with the common reporting scheme. So this is ongoing, and we will ask our partner to use as much as possible the same reporting format. And we are going to join. We would like other donors also to join the initiative. So that's what we will try to do in the upcoming coordination processes to which we participate. So I would like to finish with congratulating you for the good work and wishing you all the best. Thank you.
Thank you so much, Dominique, for this. Thank you very much for highlighting the efficiency, the simplification, all this good thing that you highlighted. We are very, very pleased to hear that. Thank you. I'm joining everyone on this call and congratulating the team for this good job and the presentation. I'm very pleased. You see the applause coming in. Thank you very much for the audience as well. Now let's have a time to answer some of the questions. One of the questions that came very early about the low reporting and low rate of boys in the reporting. So there is a kind of debate on that. Why? Maybe the boys are suffering in silence, and then maybe the methodology also that is offered is not very welcoming boys and men to report. So I would like to ask Elena and Mathilde if you can elaborate a little bit on that first, and then we go to the other questions. Thank you.
Yeah, I'm happy to start with this one. In the latest report that was written in the last 6 months, the percentage of men and boys who are victim survivors was 6%, 2/3 of those being boys. So we know, again, as I kind of said in the presentation, that women and girls are disproportionately affected by SEH because of the power dynamics and the gender inequality. However, surely men and boys are also at risks. And I think there's no one good answer to the question. It's a very kind of contextual question, and that's really why having different reporting mechanisms is so important. In one of our reports, we had seen that men and boys were using hotlines and complaint boxes to report more because they were less comfortable kind of doing a face-to-face disclosure, but that's also super contextual. So I think it goes back, somebody was also saying, is it important that we have more female representatives that are available to receive the disclosures? The victim survivors are going to be so different that it's really about having multiple reporting mechanisms to ensure that they're safe and accessible. There is not a one reporting mechanism that works for everybody. So again, if we want men and boys to feel safe and comfortable reporting, we also need to have multiple mechanisms available for them. Stop here. Thank you, Bona.
Thank you very much. Elena, would you like to add something to that?
No, I think that kind of really answers it.
Thank you. Let me jump to the ways of reporting, because there is also another question about informal reporting system. Is this professional enough? Is also this leading to action that should will be taken? So do you have something to elaborate on this informal or formal, and how this plays in terms of technical abilities and skills, and the action that it can trigger?
Maybe I think it links to the answer that I just provided. There's no one perfect reporting mechanism. I think also what we're seeing a lot, and we've seen this in GBV work, is the more we rely on phone and technology, the more likely women, girls, and boys are, the less likely they are to be able to report into that, because they're the last ones that are going to get phone or very sophisticated apps to report into. So I think that's something to consider if they are the most at risk group for SEAH, to make sure that we create mechanisms that remain accessible to them. These mechanisms can work in some contexts. And again, you'll see in our latest report that's coming out in June that we did kind of a breakdown of reporting mechanisms used in the 5 countries where we had most incidents. And it was very different from one context to another. So it's also something that's very contextual, and that really needs to be looked at the country level. And even at the country level, there's not one mechanism that's going to work for everybody. So I think it's really about having multiple entry points. But we are seeing that also face-to-face will always stay important. So I think that's also not to forget when we move towards these more technological options.
Thank you. As you are mentioning the contextual thing, there is another question about the connotation that some of the support that is being offered can have in different contexts and culture. Is there something that also that you want to elaborate about that? Mathilde?
Sorry, I had a cut for a minute and I didn't get the question. Sorry about that.
The question is about, sometimes depending on the support that are being offered, it can have some connotation in some context and in some culture. So how been dealt with?
Again, I think what we do with so as Elena was kind of saying, the HRS is still new, and we're doing a lot of this global analysis. But what we're stressing a lot in our reports, and what we're working on a lot with the PSE networks, is having these country analyses, because a lot of things are contextual. And so I think these country analyses are what are going to tell is what is going to tell us what we need to focus on, where the gaps are, what's working, what's not working. The global data is really interesting because it allows us to pick out kind of high level trends on, what we saw around children, what we saw around reporting. But if we really want to inform action, it really has to go down to the country level so that we can have these really contextual approaches.
Great, thank you. A question, a short one, specific. Could you please specify if the profile of perpetrator could be also disaggregated by local personnel, international personnel. Is there something, do you have any challenge or
Yes.
with that?
No, we have that disaggregation in all of the reports, and I answered that question in the chat. For the 2024 data, it is 75% are national staff and 10% are international staff. In the last 15%, it was not disclosed. So we have that in all of our reports available.
Good, thank you very much. Going through the questions again, just to pick up some of the main one. I want to tell the audience that all of the questions and the comment, there are some good comments and data that are being shared also in the comments. All of these things we are being kept, and then I think we will have a kind of summary and share that way with the audience. And the good thing is that there are a lot of questions. That is very good. And the other thing is that I'm trying to summarize and pick up them. So give me a few minutes so that I go to the question.
Well, maybe I could jump in for just a moment whilst you're looking at those questions. We've had a few questions in the chat, but also in the Q&A box. Thank you for those around the IQTS, Investigators Qualification Training Scheme. We mentioned that we're relaunching this. There's a question around kind of around when it will start and access to the different tiers, tier 2 and tier 3. We'll provide details, full details of dates and the costs for that. Just to give you a quick response, we've agreed with Humentum to restart the IQTS from June. Courses will start when enough people have signed up to them. So please do, if you're interested in signing up, please do check out our website and we can direct you to those options. It's worth stating that we're also continuing discussions with different donors to try to make this more accessible to people working in high-risk SEH countries. So that's another strand that we're pursuing, but more details will come in the communication that will follow. Bonner, back to you.
Thank you very much for that. We are getting close to the time that we have. I think I will, again, many questions are there. Some of them are very specific. I think we will try to answer some of the questions by writing. Thank you very much. I think I would like now to invite Tanya. Tanya, is Tanya with us?
I am, Bona. Can you hear me and see me?
I can hear you and see you. Thank you, Tanya. Welcome to the group. I will give you the floor for a conclusion and some of the things that are takeaways from this interesting data sharing, discussion, and comment. Thank you very much, Tanya.
Thank you, Bona, and thank you so much for everyone who's joined. It's really great to see all the names, but also as well to see all the communication and interest that's happening in the chat and in the Q&A. Thank you so much. Thanks, Dominique, for the kind of confidence from Echo in this and the interest as well. And Matilda and Eleanor, thanks for all the work you've done on giving the overview. The session has been really short and we've covered a lot in this hour. We are going to wrap up. And of course, I think what we need to keep in mind is we've presented a lot of statistics today. It's been a lot of numbers. And obviously, when we see these numbers, it's hard to kind of just be sort of looking at it as a system and what that means. I think obviously behind each of those is the real sobering, behind each of those statistics is obviously that represents a kind of major and in some cases a really devastating abuse that a woman, a boy, a man, or in many cases, as we've seen, young girls are experiencing. And as many of you have been saying in the chat, these numbers are only the tip of the iceberg. We know that so much happens and we know the challenges in SEA of under-reporting. And looking at all your names and titles and seeing lots of familiar names in there, obviously none of you are probably at all surprised about what you've seen today. But what we do need to keep in mind behind those numbers is what John asked us right at the beginning, which is we do need to keep outraged by every one of those numbers we see. And I think that's the point of today's meeting, which was to try and keep that outrage, and particularly right now when the humanitarian and development sector are under such existential threat. There's a lot of focus and talk right now on life-saving, rightfully so, but we all know that sexual abuse also ruins and destroys lives. So we really cannot let, and it is a real threat, and we feel it very much at the Alliance, that there's a real threat to the good work that's been done over the last 2 decades to try and put more focus on the challenges around sexual abuse, exploitation and harassment that we know happens. And we know it happens when there's even larger vulnerabilities and power abuses in the sector, along with a kind of corresponding work on gender-based violence. So I think we all have a responsibility to keep that outrage and ensure we don't go backwards and let those numbers and statistics go even higher. But to do that, we're going to have to think a lot smarter. We're going to have to think a lot more collectively. And that's why these schemes that we've been showing today are so important. We're really going to have to collaborate. We need to be guided by the core humanitarian standard and the commitments, and we need to unite around harmonised reporting scheme and the misconduct disclosure. So maybe in closing, if I can, maybe just kind of 3 sort of calls to action to wrap up and summarise. I think let's kind of keep that outrage and make sure that those numbers, what those numbers mean and represent, and make sure that we don't go backwards in the fight against sexual exploitation, abuse and harassment. Let's really try and keep the challenge that we're under as a call to action to really unite, not think about our own ways of doing things, but what we can do if we join forces together. And then of course, finally, going back to what John asked us at the beginning, let's try and keep that outrage about what this represents. Thank you. Back to you, Bono, and thank you again, everyone, for joining.
Thank you very much, Tanya. I'm joining Tanya to say thank you for everyone who have joined, but also special thank you to our speakers who shared the thing. I'm very pleased to see these hearts floating on my screen. I know this is why I'm saying thank you very much. I think, as Tanya said, this is a very short time. It's not covering all the things that we would like to discuss and share, but bear with us. Keep your eye on our website to follow the data and the next development. Thank you very much. As we have 1 minute, what I would like to ask you, if you can show your screen. Sorry. We are not. Okay, thank you. I wanted to ask for a group photo, but it seems like complicated to get. So thank you very much. We have been very efficient. We have finished on time. Thank you very much, and see you very, very soon. And I think this discussion will continue. Thank you very much.